Good evening, friends. Today we are going to see about the very common thing what we are discussing with the doctors when we are promoting our product. We always says that my product, my drug belongs to this pregnancy category A, B, C. Like that, we say different categories. Now we will try to find out what does this category stands for and whether it is safe or not for a pregnant woman. So before start watching this video, I request you those who not subscribed till now, please go for subscribing the channel and to get more inputs and more videos related to the medicines, particularly which is very useful for the students and medical representatives. What are these categories and how it is classified? There are five categories. So category generally A, B, C, D and X. Sometimes we can call as E. Right. What does this category A stands for? The category A stands for the drug. So before we should go for this particular point, we should know what is actually happening to the newly discovered drug. The newly discovered drug undergoes two major processes. The first process we called as preclinical study. The drug was given to animal and they will check whether the drug is safe, efficacy, whether it is effective in the animal, and whether it is safe for the animal, and whether it's provide the therapeutic action or not. If all these three category is successful, then the same drug will be provided after taking proper approval from approving agencies. Then it will be conducted as a clinical trial for human being. So the clinical trial majorly classified into two type. One is preclinical trial and another one is clinical trial. In preclinical trial, we conduct the studies for animal to check the safety, efficacy, and therapeutic action. And in clinical trial, there are four types, four phases, and here we are conducting in the humans. So, like that, the category A belongs to the category where the drug has conducted clinical trial in animal as well as human being, pregnant woman, and it was found more effective, and there is no evidence of any fetus damage. So generally when you are considering pregnancy woman, you have to worry about the fetus only, whether the fetus is going to get affected by the medicine what I am taking or not. Right. So if any category of the drug which comes under category A, that category is safe for pregnancy woman. Right. Because the clinical trial proves that it is safe. Then what is category B? Category B, the animal study shows that there is no risk to the fetus, but we don't have adequate amount of clinical trial in pregnant women. In simple language, we don't want to go for taking risk because we found that it is safe in animals, and based on that we are thinking that okay, we can go with human being also. It is not going to create any uh, unwanted side effects. So we don't have sufficient amount of data with us in a well controlled steady manner. So this category B drug also can be used sometime on risk benefit basis, right? And now then category C in animal also shown adverse effect fetus problem, and in human being also it is definitely going to cause any damage to the fetus, but this medicine can be provided to the patient who is in need, what we generally scientifically we call that justified potential risk benefit. So the medicine can be provided on the risk benefit. So category C is not safe for pregnant women. Now the next one is category D. The category D found even in the human fetal also the risk was found, right? And again, the risk benefit basis only this can be provided to the patient. And category X drug, it shows fetal abnormalities both in the case of animal as well as human being. and definitely this type of category drug should be totally avoided during your pregnancy conditions. So whenever we are in pregnant, one of the happiest moment for a couple when they are going to be a parent. So during the happiest moment, we try to take utmost care for each of us, and that time, during that time, there will be more chances that we will do more medical error. Medical error chances will be more. We thought that I have to take care of my wife and I have to provide everything for her, so I will provide the new natural supplements to her from the first month onwards, and I can go for natural boosting agents and all. So all those things should be avoided, because if you take any natural food items which was provided or which was advertised in the televisions, that clearly says that this is not to be provided to the first 3 months of a pregnant woman. Okay, what are all the general drugs we are taking without the knowledge that it is going to be harmful, and the drugs which are available freely in the OTC over the counter market? What is this over the counter market? If you are going to the medical shop and if you are asking for the medicine, and if the medical shop person gives any medicine without prescription, that we call as over the counter medicines, right? So generally we never used to discuss with the medical shop person that we are pregnant, or we are 6 month 3 month, whatever it is. Even it is not visible for some people also, right? So I am going to list out some drug which is potentially harmful if you are taking the medicine without the knowledge of that particular medicines. What are all the medicine which are freely available? The first category is the pain reliever. We always feel very painful during the pregnancy, so to overcome this pain, we go to the medical shop and we will ask to give a painkiller. And generalized painkiller what they used to give is ibuprofen. So the ibuprofen is very common, which was provided by the medical shop person, and he never asks you whether you are facing problem of pregnancy or not, right? So this ibuprofen, what it will do? It will sometimes leads to miscarriage also. If it is, if you're not aware that if it is not happen miscarriage, definitely it is going to cause the heart problem to the fetus. The baby may not have chamber. The baby may have less number of chambers. So in case by default you took the medicine, you are going to face, or you are going to pay a huge price for this simple mistake. What are the commonly available medicine of ibuprofen? Brufen, Compiflan, all these commonly available medicine. So these medicines are good, but it is not good for a pregnant woman. So as a pregnant woman, you just be very careful when you are taking this ibuprofen, aspirin. If you take aspirin, this is freely available in the form of ecosprin, disprin, and all those things. Obviously, aspirin is prescribed in low amount in the patient who is having miscarriage, frequent miscarriage. But again, I am repeating that all these medicines are useful, beneficial when it is for a normal person. It is not going to be a beneficial drug for a pregnant woman. It is not going to create any benefits. Right? Please keep this in mind. And the another common problem what we face during pregnancy is acne. And nowadays the current generation don't want to show off this. Acne is the abnormal hormonal changes reflection. So we go for treatment. Definitely we never go to the skin specialist. We go to a medical shop person, and medical shop person provide you some medicines, right? And that medicines, ac- acnitoin, so one of the commonest thing which was taken by you, so that is going to cause again severe birth defect to the baby. And sometimes if you take antibiotics to overcome this acne, and that is also going to cause you unwanted side effect, particularly the bone growth and the tooth discoloration will happen in this fetus. See, we thought that it is just a simple treatment for acne. No, it is not a simple treatment for acne. This is going to be a harmful effect for your babies. And common antibiotics like streptomycin, kanamycin, and fluoroquinolones. And we always get mood disorder problem during the pregnancy. We call as pregnancy induced hypertension. That time we will take medicines to take care of the mental health. So that medicine is also going to cause problem for the heart of the fetus. The fetus heart will be going to be affected by these medicines. Please keep this in mind before going to take any medicines from the medical shop. Take the medicine and see the back side, where it is mentioned, what it is mentioned, whether it is pregnancy A category, B category, or C category. And then you try to ask the pharmacist. Pharmacist has the rights to give you a reply to the particular question, whatever you are asking. So please be careful when you are taking medicine during your pregnancy time, because these medicines are very commonly available and we used to take regularly. So we never thought that it is going to cause any big problem. Not only this medicine, it is a big list we are having. Hormonal medication, oral contraceptives. Sometimes some people feel that during pregnancy, if I have a sexual relationship, I may get again some other issues. So they used to go for taking oral contraceptives. All those unwanted things should be avoided. So that is going to cause the major problem for the fetus only, right? And anti-epileptic and anti-seizure medicines, that is also going to cause problem for your babies. And to blood pressure, uh, normally this is going to be, that's why it is called as PIH, pregnancy induced hypertension. So if you are taking medicines for that, definitely it is going to cause kidney damage and growth restriction in your baby. Okay, all this allopathy medicine is going to cause problem. All the, I will go with Ayurvedic. Friends, please keep this in mind. Even herbal medicines are having same type of side effect producing abilities. I provided some examples here, right? Tanquai and blue kosh. So all these are going to cause changes in your hormones, and hormonal changes induce definitely your pregnancy, and it will affect your fetus also. Even high dose of vitamin A is also going to cause you the risk of birth defect. So whatever you are going to do during the pregnancy, make sure that you are taking care properly by taking the right medicines. Check the medicine what you are providing to the pregnant woman before taking that particular medicine. Thank you for listening, and please let me know what type of videos you need, which you are expecting that we should know about that particular uh, concepts. Definitely I will provide you such type of videos in simplified language. Friends, again I am repeating that these are the simplified version of this science, and this is not the full science. So if I am not here to make you as a MBBS MD doctor, I am here to just provide you some ideas, and some, I just want to make some clear view about some of the general misconception myths. That is our main duty of mine, and I am doing for that purpose only. So thank you for listening. Have a nice day.